I was actually starting to feel like a little bit reassured that they were starting to listen a little bit more so. So now fast forward, my dad's actually been doing pretty well for quite some time, UTIs here and there, but been doing really well. And then it was really strange. I got in, I want to say it was early March, a letter from the Grand to my house inviting me to like interdisciplinary care team meeting or something like that, which apparently they have every quarter, I believe, in which, dietary, physical therapy, social work.
Oh, like a care plan meeting.
Yeah, yeah, something like that. Yeah. Inviting me to it. And I'm like, this is amazing. I'm like, I'm so, why am I all of a sudden getting invited to these? I'm so excited. So and it was just a few days notice by the time I got the invitation. I call back and say, listen, I don't live locally, but is there a way we can do this like a teleconference? Oh, absolutely. No problem. And I'm like, I'm so glad, because my dad had been trying to get dentures for like a year and a half. And every time I talked to the social worker, like, oh, I'm not sure. But then it got approved, but then they didn't have someone that accepted Medicaid in Rome. And I'm like, is Utica or Syracuse broken? Like, why is this hard? And I mean, for years waiting for dentures. I mean, this was like a point of something that he was embarrassed about. Like, he didn't have very many teeth left. And it was really embarrassing for him. Like, the guy has insurance, get him some dentures. So I called my dad in advance and I said, hey, look, I'm going to be able to call into this. And he was like, oh, are you sure you have the time? I'm like, yes, like I scheduled it for a time when I have the time. What's been going on? Let's get this addressed. So I'm not getting my Parkinson's medication on time. And when you don't get your medication on time for Parkinson's, it's kind of like you slowly almost become like more and more frozen. Like, you could do less and less in terms of movement. And so it's really important that he gets them on time for him to maintain his mobility. And he would even like start to mumble, and when the doses, his dosing of his Parkinson's meds would wear off. So I could tell when I talked to him on the phone, like if he was not having a good day with his Parkinson's, because it would be harder for him to understand. And then some days you would call and his speech would be perfectly easy. So I'm not getting this. What's going on with my dentures, and a couple other more minor things. So I call in, I'm on the phone. Everyone's very receptive. Oh, we hadn't heard this about the dentures before. I roll, like, how many phone calls have I made? So clearly it wasn't documented and no one passed it on. But okay, for his medication, yes, we'll make sure, like, we'll work really hard on that. I know sometimes it's difficult. Like, I'm not saying like you have to give them at 8:03 a.m. every, like I get it. They just can't be off by like 3 hours or completely missing doses. So after this, I call and check with my dad. Yeah, I'm getting my medication on time. Like, they're looking into the dentures, and I was like, wow, we really turned a corner here. This is really helpful. But on that meeting, I remember, so things were starting to come out about SARS-CoV-2, COVID-19. And it was on that call they told me, by the way, we're not going to let residents leave and people can't come and visit anymore. And I remember my dad, this was news to him. It was just broken to him then, being utterly devastated, because he was supposed to go to his granddaughter, my niece's play that she was in Syracuse, in like a few weeks' time. And he was like, I'm leaving. I don't care. You can't. I'm like, Dad, like, this is like, I know that there's some crap that goes on here, Dad, but this is actually the right move. This is the right thing to do for your safety.
Right, Dad, listen to the professional. I'm a
Right.
professional in infectious disease.
Right.
This is the real
What
deal.
So he was really disappointed. And then that meant that I couldn't come up to visit. And he was just absolutely heartbroken. I want to meet my granddaughter, when we'd FaceTime, or we communicated, actually not through FaceTime, but through Facebook Messenger.
Right.
He didn't have a cell phone. So, well, he did, but he like an iPad and a computer that we would use to talk over the internet through FaceTime, through Instant Messenger. And that's how he messaged me as well. Because he could get on the computer and type, as opposed to trying to
Right.
text. So then that meant we couldn't come up and visit, and he was so sad, and I was sad, and I just felt so bad that this was the situation. And so I was actually kind of impressed with the Grand for a very short period of time, because they called me, like, I want to say a couple weeks later, like, this is our policy. We're going to have, if people do get sick, we have a quarantine unit, like a separate unit, and this is all the precautions that we're taking. And I'm like, oh, thank you so much for calling me. Like, this is really reassuring. And I don't, when I say this, I don't at all mean to diminish the severity of COVID-19. It's obviously dangerous for anyone, but we obviously know that patients that are elderly are more likely to have a poor outcome. And so out of everyone that I knew and loved, the person I was worried the most about was my dad. You know, he lived in a congregate care setting in a nursing home. We all know without my direct experience that nursing homes are not great for infection control. Like, we forget the multi-drug resistant bacteria, process. They're not. I do a lot of work with C. diff, if you've ever heard of that organism that causes an infectious diarrhea. And unfortunately, nursing homes don't do so well with C. diff because of just the nature of how things are set up. And it's hard to do, appropriate terminal cleaning. So I was very worried about my dad, and just at the time there was not so much personal protective equipment, and I wasn't very confident. So I was really worried. So when I received this information from the grant, it's reassuring. And so fast forward to this, I get this letter in the mail, and it was actually much later, but I'm going to read this to you, and then I'll tell you the situation. So it's dated April 10th. Dear residents, family members, essentially it's a follow-up letter that they distributed last Friday. I didn't get that last letter, but okay. And it's saying that they shared the previous week that a single resident had been diagnosed with COVID. Now, I knew this because my dad had messaged me and said 3 people died of COVID.
And I'm sorry, what were the dates that your dad messaged you?
That was, I believe, on the 6th of April.
Okay, so your dad is sending you a private, is messaging you, reaching out to you saying 3 people have died of COVID, and you're getting a letter later on from the grant saying that they have 1 resident who has tested positive.
Right. So let me pull, I didn't delete anything. I have all the last,
Yeah.
You can see missed audio calls kind of blurred out, but let me go back to, okay. April 3rd on lockdown. Let's see. Yeah. So everyone's doing okay. Yeah. April 3rd on lockdown here. Cannot leave room. I said, someone has COVID-19, I'm assuming. No one, just cautious. I said, okay, good. And then on the next day, April 4th, what is the temperature that is the danger zone if infected? 100.6 or higher, question mark. And I said, 100.4 or plus is considered a fever. And I said, do you have a fever? No, 100 or lower. Later that day, April 6th, 97.6 today. I'm sorry, next day, 97.6. April 6th, we have 3 deaths of COVID. And I wrote 3 deaths, like numerous exclamation points, question mark. And so I called him right then and there. I stopped what I was doing and I called him. We talked for 9 minutes because Facebook Messenger tells me the audio call. No, I'm okay. Like, people have COVID. I'm afraid of people having COVID. This is not an ideal situation. I'm locked in my room. Like, this is obviously very serious. My son and the baby were, when I brought them over, so he could hear them. We try to do video call, but it's constantly like a bandwidth issue.
Right.
And so it was, the last time it was like really choppy. So he'd kind of given up on video calls at the time. So we just, I put him on speakerphone, and my son was, called my dad Papa Fosse, short for Grafossi. And then, the baby was, doing her little cooey noises. And so we were chatting. I'm like, okay, if you feel bad at all, like, let me know immediately. Okay. No problem. And then I sent him a whole bunch of, pictures right after of the kids doing stuff outside. So, I still hadn't gotten this letter yet. So then the next morning I message him, feeling okay, question mark, no reply. And I'm like, okay, now what I'll say is I'll take responsibility here. I should have followed up sooner. I didn't. So no reply. But that being said, it wasn't unheard of that my dad didn't return every single one of my messages. Like, if he wasn't sitting at his computer or if he missed it, maybe that was the case.
But this is what we do as children. We beat ourselves up.
Right.
We put ourselves on trial. We look at every single thing we could have done, should have done. Right. And that's what we do as children when we have a parent in the situation, is we prosecute ourselves.
Absolutely, we do. So then on the 8th, at 11:21 a.m. I text him again, doing okay, nothing. I'm like, okay, this is strange. So let me look at the date of the 8th. Because I remember, okay. So I believe it was the 8th, nothing. So on, I think it was the 9th, I have to go back and, the trouble with the records from the Grand is a whole bunch of them are on CD, and a whole bunch of them are paper. And so some of the nursing notes are on CD, and I don't have it pulled up here in front of me. I'm sorry, ill prepared. But anyway, I believe on the 9th or the 10th, my brother Mark called me. I think it was on the 10th, and said, the nursing home just called, Dad fell. So now I'm irritated. I'm like, why are they calling you? Not that there's anything wrong with calling him, but they should be calling me. Like, clearly I'm the person that calls all the time to check on him. Clearly I'm the person attending this, care plan meeting. Clearly I'm the person that's raising hell every time they don't do the right thing for him. Like, why are you calling my brother? So I call back right away, and I talk to, I think it was, I don't know if it was an LPN or the RN. And I say, my brother called me and said, my dad fell. How is he? Oh, he's okay. He's a little grumpy today. I'm like, what do you mean grumpy? Like, oh, it's just kind of in a crabby mood. But I remember it had been snowing there that day in April. My mom had told me. And so I was like, oh my gosh, how miserable. Because I constantly joke about how I don't live where it snows all the time and I don't miss any of that. So I'm like, okay, well, if I was alone in my room, couldn't leave. Oh, I'm sorry. Very important. Very important. Let me back up. The day I talked to my dad on the 6th, he told me that his roommate Leonard had gone to the hospital overnight and he wasn't there. And I was like, what do you mean? Is he okay? And he's like, I have no idea. I was like, did he fall? And like, maybe they're worried that he broke a bone. He's like, I have no idea, Marissa. He's just not here. And so I'm thinking, okay, well, now he's probably worried about his roommate. He's now alone completely by himself, really no one to talk to, can't go anywhere, can't have visitors. It's snowing. There's a pandemic. He's scared. Like, I'd be grumpy too. I totally rationalize it, but they told me he's fine.
And he and Leonard were close.
Very close. Yeah. Yeah.
Because the Sullivan Times did an interview with Leonard's daughter, Rosemary. So we heard Leonard's story. And Rosemary referred to your dad as her father's best friend.
I would say that's absolutely correct. Yeah. I mean, there was an age difference there, but I mean, they were buddies, and
Leonard was almost 20 years older.
Yeah.
Right.
Yeah.
He was considered older.
And I actually met Leonard before he was my dad's roommate. And so they weren't always roommates. This was a fairly recent thing because the Grand called me essentially asking my permission if it was okay. So I remember them. Yes, it's okay for him to be roommates. And I told my dad, and I was like, would that make you happy? And he's like, yeah, Leonard's my buddy. And I remember I had previously met Leonard when I was visiting my dad. I think it was I came in July around the time of the World Series of Bocce. I was I was pregnant, visiting, thinking, okay, this is probably going to be the last time I visit. I'm supposed to have a baby in October. And the World Series of Bocce is always like when everyone comes out in Rome and gets together. So it's a really fun time to visit. So I remember Leonard like wheeling himself down to my dad's room and thinking that he was like the most precious, cutest little man that I had ever seen in my entire life. And I didn't really know much about him other than he was super cute. And then I actually had found out way after all this, actually after my dad had passed, that Leonard's family would visit all the time, bring my dad homemade food. And I mean, I just, how completely wonderful is that? Like, just what absolute lovely humans to do something like that. I mean, and they were like, your dad was like family to us too. And just so incredibly wonderful. And I'm sorry that I live far away and I didn't know that was happening, or I would have been in contact with them more often, or anyway.
Right. So for your dad to say to you that Leonard, he just woke up and Leonard wasn't there, was probably concerning.
Yeah, absolutely. So anyway, the nurse assures me my dad's fine. He's just grumpy. And I'm like, okay, well, I'm going to take your word for it. And again, I'm forever sorry that I didn't say, can I talk to him? Like, you know what I mean? Because I had been trying to call him and he hadn't been answering. And they're like, no, he's fine. But we're going to get an X-ray just to make sure, because he fell. He apparently, they said that we had bought him this recliner chair because he had all these back problems and had a hard time, getting up. And so he could like sleep in this recliner chair and then, like move himself up. I think it had like a bit like a motor to it or something. Anyway, he's like, I guess, slid out of that chair just gently on his butt when maybe they thought he was reaching for something. I'm like, okay. So that was the 10th. And then I called him go back to Messenger. On April 12th, which was Easter, I sent him a whole bunch more pictures of the baby with like a little Snapchat filter with like little bunny ears and like a little video of her doing something. And he didn't reply. And then so I called him at 1:15, thinking, okay, well, he'll at least call me, answer my phone call on Easter, didn't answer. And then so at 6:18 p.m., I called the nurse's station because I thought, well, maybe the Wi-Fi is down because we communicate through, he has to have a Wi-Fi connection. And this had happened before, I think just as recent as, it was definitely in July, it was down for a prolonged period of time. I couldn't talk to him. And he does have a room phone, but he very seldomly answered it because he wouldn't necessarily be able to get there very quickly.
Right.
And he had a hard time hearing on that phone. It just didn't work out super well. So that's why we usually did this. And so I called the nurse's station and the nurse said, I said, hey, this is Marissa, Mike's daughter. I've been trying to get a hold of my dad for days and it's weird he's not answering on Easter. Like, is your Wi-Fi down? I'm like, what do you mean is our Wi-Fi down? I was like, oh, this is the only plausible explanation I could have for this. And she's like, oh, hold on a second. And then I put on hold to get someone else. They're like, yeah, your dad's not really feeling quite well. I'm like, what do you mean he's not feeling quite well? No one's called me. Like, I was told, I called the 2 days ago because he fell. Like, is that? And they're like, no, he's having a hard time breathing. He's on oxygen. And I'm like, what?
Now, previous to this, he was not on oxygen.
No, it's never on oxygen. Never baseline on oxygen.
So
No,
this is surprising for you to hear that your father is on oxygen.
Right. So this is acute. Yeah. And so like, I already immediately know what's going on, right? I know that my dad has COVID because what else would it be other than maybe a bacterial pneumonia, although he was supposedly just fine. And now there's all these, reports of people having COVID at the Grand. And although I'm not directly providing care to patients, I follow COVID closely. I work with COVID in a different fashion in my current role. And so I recognize the signs and symptoms associated with potential COVID. And so I'm like starting to panic. I'm like, what do you mean he's on oxygen? Why has no one called me? How long is this? Oh, it just started today. And I'm like, I'm asking all these questions. Does he have a fever? How much oxygen is that? Hold on. Let me get you, let me look this up. Okay, it says here, he's on 15 liters non-rebreather. I lost it. So 15 liters non-rebreather. First of all, a non-rebreather is when you put like the oxygen on and it's got that little bag.
Yes.
To try to make sure they can get as much oxygen as possible. And 15 liters is pretty much the most you give someone oxygen via nasal cannula. So, and actually my heart rate is starting to accelerate even reliving this. And so I'm like, 15 liters on a rebreather, like why is he still there? Why is he not in the emergency room? What's his oxygen now? Oh, well, it's in the 80s now. I'm like, what is going on? Like, send him to I might have even said something like, are you stupid? Like, why is he still at your nursing home? And I mean, I was not nice because I was disgusted, panicking, infuriated, terrified, and I can't do anything. I'm not there. And so I just remember being like pretty direct. And I remember the nurse saying, you can't speak to me this way. And I said, I'm sorry, please put this person on the phone that I can speak to this way because we have a major issue here. So then I get Sarah, who is, I believe, the nursing supervisor. And I'm like, what is going on? And she's like frantically looking through notes. Oh, and he doesn't have a fever. Yeah, he's was on a small amount of oxygen, but it was still low. And so now it's 15 liters non-rebreather. He's still sat.
Oh, Marissa, hold on a second. Hold on, you froze for a second. So he was
sorry.
Yeah.
He's still saturating. Is he still saturating in the 80s on 15 liters non-rebreather? Like, look, this is by definition, respiratory distress. He's an acute respiratory failure. Like, what? He's just hanging out in his room on 15 liters and under a breather by himself. And like, you guys think this is cool? I'm like, you don't send him to the ER. Like, I'm beside myself. She's like, I understand. She's like, okay, as the nursing supervisor, I can send him to the ER if that's what you're requesting. And it's like, yes, I can't believe I have to request this. And so then I want to, and I'm like, when did this start? Why has no one told me? Like, I just talked to a nurse on the 10th. She said he was fine, but grumpy. Like, and all of a sudden, 2 days later, he's an acute respiratory failure. Like, what is going on? Well, Marissa, I have to get all this paperwork ready if I'm going to call the ambulance and send him to the ER. So I can't do all of this and answer all your questions. Can I do this? And then you call me back. And I'm like, yes. So she hangs up. I immediately call the ER because I'm not taking any chance that they're going to say the right thing. Like,
right.
Plus, I want to let the ER know I am 100% positive my dad has COVID-19.
Right.
Like, what else is this? And so I call the ER by some like absolute random fluke when I called the switchboard and said, can I have the emergency department? When the switchboard transferred me, it went directly to an emergency room physician. And so I'm like, he's like, Dr. So-and-so. And I'm like, hey, this is who I am. This is what's going on. And he's like, do you think it's possible your dad has COVID? I was like, that's what I'm calling. I'm certain he does. So I just want to make sure that you guys take every precaution to protect yourself, and anyone else here. This is what I know. And he's like, okay, thank you so much for calling. I gave him a heads up, and oh, sorry, let me back up. The nursing home. So Sarah, the nursing supervisor said, well, your dad's DNR DNI. So that is do not resuscitate, do not intubate. And I said, I didn't know that. But okay. She's like, so you still want us to send him? And I said, did he code? She's like, well, no. And I said, okay. So it's shocking to me he's a do not intubate. I can't imagine why he would be a do not intubate. Like, to me, when people sign do not intubate orders, that's typically if they're terminally ill. And so let's be honest, is my dad ever going to recover from Parkinson's? No. But was he like totally with it and just mostly ambulating in a wheelchair, but otherwise with it? Yeah. So it's like he wasn't going to die anytime soon. Like, it wasn't like he had terminal cancer. And like, why would you prolong someone's life in this situation? Like, his MOLST form, his medical orders for life-sustaining treatment, said that you send him to the hospital if he requires, if his clinical situation warrants further care, which obviously it did. So it's like, what does DNR DNI have to do with anything? And plus, I'm shocked to find out that my dad signed a do not intubate order. And honestly, when you're signing those orders, you're probably thinking of, I don't want someone to put me on a breathing machine to keep me alive if I'm otherwise going to die, not let me do a trial of mechanical ventilation to see if I get better from this infection.
Right. And a MOLST, for people who maybe don't understand this, because I have one with my mom, it is like a pretty intense questionnaire. And a lot of that could be covered with that. Like, it's like your end of life wishes. Like, my mom doesn't want to be prolonged in a vegetative state, so we're not going to do, certain things. So, but we do not have a DNR. We do not have a DNI. My mother leaves it to the MOLST, and I'm her healthcare proxy. So, but those things need to be explained to people when they're signing. So for like your dad, like, who was present with him? Who was explaining things
Exactly.
to him?
They said that they review them quarterly, and it's like, what? I can't imagine my dad would sign a do not intubate order if he knew that meant if he had a respiratory infection, that they were just not going to try to get him over that hump with potential mechanical ventilation. So I tell this to the ER doc, and he's like, okay, I'll visit that with him when he comes in, because I'm not going to do anything against my dad's wishes.
Right,
and so
right.
The doctor called me shortly after my dad got there. So it took 50 minutes from the time I called.
It's 50 minutes.
50 minutes from the time I hung up from the Grand to by the time my dad got to the ER. It's like, I don't know, a mile and a half down the street, on the same street as the nursing home.
Wow.
Yeah. So the doctor calls me back right that, right when my dad got there, and he's like, look, your dad is you're in respiratory failure. Like, he is on 15 liters non-rebreather. He's still saturating in the 80s. Like, we either intubate him now or this is it. And so he's like, what do you want me to do? Because I was my dad's healthcare proxy. And I said, well, what has he said? And he's like, he's having a really hard time talking because he's so out of breath. I'm having a hard time understanding him. And I said, can you put him on speakerphone? And now I am, again, how many regrets am I at now? I guess this is my third regret. I was very much like not a daughter, and instead I'm sorry, one second. This is on TV. Walk away. I am very much in a healthcare provider mode, right? Not, this is my dad and might be the last time I speak to him. So I said, can you get my dad on speakerphone? So I say, Dad, it's Riss. That's what he called me. Do you want to have, probably have COVID. Do you want to have a breathing tube put down your throat to help you breathe to see if you can get better? Very clearly, yes, that I heard, the physician heard, and the nurse taking care of him heard. So by then he rescinded his do not intubate order. So if that tells you, it was shocking to me he had a do not intubate order, and I don't think he understood probably what he was signing at the time. But regardless, no one asked the nursing home to intubate him. They don't intubate people in nursing homes. So his MOLST form said that he wanted to be sent to the hospital if his clinical care warranted it, and they did not do that. They did not abide by his wishes. It was me by chance calling to find out that my dad was critically ill and respiratory failure, and me insisting he go to the ER for him to get care. So, the ER physician was like just telling me how sick my dad was. The nurse was saying how sick he was, obviously. And when I had him on speakerphone, I should have said, like, I'm so sorry. I didn't know you were sick. I would have made sure, I had no idea. They told me 2 days prior that he was fine, but grumpy. Like, I knew none of this. So I didn't say goodbye or just in case. I didn't say any of these things. I had just, I was in a hurry up and get him the care that he needs mode. So, he did well for a while, and he went straight to the ICU. Obviously, he was on intensive mechanical ventilation. He did well for a bunch of days. And then, his labs looked good. And I thought, wow, he might actually pull through this. And then he went into cardiac arrest. And he was resuscitated really quickly with CPR, but then the doctor called me, and it's his respiratory wise, his ventilator settings were actually doing pretty good. He wasn't really having fevers. He wasn't requiring blood pressure support. And then all of a sudden he was, and then his kidneys, started to fail. And so they transferred him to St. Elizabeth's because Rome Hospital doesn't do hemodialysis, which I had no idea, or I would have made sure that he was transferred someplace before that did, just in case, because a lot of the patients this sick with COVID were requiring hemodialysis. Anyway, so they transferred him because it's, he coded, but he came back really quickly with a little bit of CPR. And so they transferred him, and I was going to wait to call so they can get him, by the time the ambulance came. And they called me shortly after from St. Elizabeth's, and he was in VTAC, like he was arresting like repeatedly there. And, they were like doing all like all these, he was in metabolic acidosis. They were like, doing bicarb drip, and, the nephrologist was there and cardiology was there, and they were doing all these interventions. I was like, look, like, this is the part where I didn't sign up to make him suffer. Like, his body's giving up, his heart is giving up, and so subsequently his lungs are giving up, and everything. So I withdrew care. I did request that a nurse stay with him and hold his hand. I did get to FaceTime him when he was in Rome Hospital right after he coded. So I got to see him, but he wasn't awake. I don't know. His sedation was off. I don't know if it's possible if he heard me or not. But I apologize that this even happened to begin with. And just said I guess my piece, but yeah, so we withdrew care, and obviously couldn't go there, couldn't have a funeral. Heartbreaking for all of us. Sorry, 1 minute. So yeah, I get it. I get that people get COVID and they die. And even maybe if he would have got care sooner, maybe the outcome would have been the same, maybe not. But there is no excuse in the world to not inform family members that their dad is sick. There's no excuse in the world not to send him to the emergency room when he's that sick. And so, I'm on a fact-finding mission the entire time. He's, the next day I call back Sarah. I want like, when was he sick? What information do you have? What happened? I call in different shifts to try to find other nurses that maybe took care of him, to try to figure out, oh yeah, he was sick on all day long on Saturday. He was saying, Deb, you got to help me. I need help. And I'm like, why did nobody call me?
Which has to be devastating for you to hear as his daughter, that he was begging people to help him.
Yes. And and then here's the guy, here's a man who called me when he knew he had a urinary tract infection and knew that he wasn't going to get treated appropriately if I didn't intervene. Like, I have messages from him where he sorry to bother you, Riss. You're the only one that I trust, can you, this is what's haunting to me, being in your room alone and so sick and probably wondering, why isn't my daughter called? Why isn't my daughter helping me? And clearly being so sick that he wasn't capable of reaching out to me himself. I mean, there's no reason that they didn't call. There's no excuse in the world, and there's no excuse in the world they didn't send him to the ER. And so I keep trying to find all this information. I talked to the nurse administrator at the time, Nathan Anderson. So in the meantime, by the way, I get this letter. So back to this letter. Oh, sorry, I'm all over the place.
No, it's fine.
The hospital told me, did you know your dad's roommate had COVID? They didn't tell me his name, obviously for HIPAA purposes, but so I'm like, no. So now I know why Leonard wasn't there magically when my dad woke up. So the nursing home knew that Leonard had COVID. And they knew that my dad was sick and had these symptoms. Why would you not assume he had COVID? And so I call.
Now, if people go back and watch the Sullivan Times interview with Rosemary, she talks about Leonard's story. She actually had to call an ambulance and have him removed because he was reaching out to her and she couldn't get anyone to go in and check on him for hours. So yes. She finally, and she had expressed her regret at not having your contact information because she felt terribly that she was really concerned about your dad.
Yeah.
Because she knew her dad had COVID and trying to find a way to reach out to you, which is not the responsibility of the family.
No.
It's the responsibility of the facility and the healthcare professionals.
Absolutely. Yep, absolutely.
I mean, so you live with this regret. Rosemary lives with this regret, but the burden of responsibility for care was left on the shoulders of the Grand.
Yeah, that's what they're paid for. That's their job. They sign up. It's a for-profit nursing home. This is literally what you get paid to do, and you're terrible at it. So I call Nathan Anderson. In the meantime, I get this letter, and I circled part because as I read it, if during these challenging times your loved one is suspected of contracting or has been diagnosed with COVID-19, we will of course contact you immediately. This letter was dated 2 days prior to me insisting my dad be sent to the ER. And I received it after. This is what you said you were going to do. This is the bare minimum, and you didn't do it, and they knew. So I call Nathan Anderson. I'm obviously furious, heartbroken. My dad's still alive at this point in time in the ICU, and I'm like, I acknowledge that you can't go back and undo what happened to my dad, but there are a lot of other people that still live there, and all of this is unacceptable, all of it. So I want you to do a root cause analysis and figure out how it's possible that A, no one called, and B, no one decided to send him to the ER. And by the way, this is probably to him now my third request, because I requested numerous nurses. I said, call the nurse practitioner. I want to speak to her. Because they told me that the nurse practitioner saw him, my dad, and ordered a chest x-ray. And obviously ordered the oxygen. And I said, she owes me a conversation. I want to understand what her line of thinking was. She has to call me back. No call, no call, no call. I tell Nathan Anderson, I want you to figure out where the failures were in the system, make sure they don't happen again. I want to speak to this nurse practitioner. I want you to go through the notes and see when, like, look up this documentation. This is a massive failure. Okay, I just want you to know, I loved your dad and Leonard. We had a little birthday party thing for Leonard. Everyone loved your dad. This is heartbreaking for us. It's like, is it so heartbreaking? Couldn't make a phone call, so heartbreaking you couldn't send him to the ER. And I can't tell you how many times someone at the Grand said, well, he was DNR, DNI. Once again, DNR means don't resuscitate him if he coded. He didn't code. Do not intubate means don't intubate him. Last I checked, there's no one qualified of intubating anyone or putting them on a ventilator at the Grand, because that's just not how it works. But also there's no one there capable of placing a peripheral IV. So let's be honest of what their capabilities are here. So I didn't ask you to resuscitate him or intubate him. You didn't go against his orders in that regard. You were supposed to send him to the hospital if he required care, and you didn't. So this is what I'm trying to get to the bottom of. So Nathan's going to look into it. I don't hear back. I don't hear back. I don't hear back. So this was Monday. No, I'm sorry. On Monday, I spoke to Alice, who was kind of in administration, but not really, and like filling in because Nate was off, and she was going to look into it as well and scrambling to go through notes. So I talked to Nate on Tuesday. On Friday, I still hadn't heard back. I called back again, because I had left a message on Thursday. I talked to him, and he says, because before he was like, oh, you're from Pennsylvania, like whereabouts? I went to like trying to like build some type of
Rapport.
Rapport.
Yeah.
I'm like, okay. And he actually had me fooled into believing that he was genuine and actually cared. And then I talked to him on Friday, and he's like, oh yeah. And he's like, oh, let me look to see when he had a fever. I'm like, hello, irrelevant at this point in time. Like, he was in respiratory, like, no, like, I didn't ask you this. Why did nobody call? How have you handled this? How are you addressing it? And he's like, oh yeah, I looked into it. Yeah, we have 24 hours to notify you, and we did. And I said, me calling to ask if your Wi-Fi is down because I haven't heard from my dad, and subsequently finding out he was critically ill, is not the same as you calling. That's not the same. Oh, well, I was like, no, there's no, like, you know what? I'm going to take this into my own hands and get to the bottom of it, because you clearly don't care and you aren't taking, no, it's not. I'm like, no, clearly this is the situation. So that was that. My dad, we withdrew care on the 20th of April, and he died within minutes, and they called me back. So I had to figure out how to get my dad's medical records. I couldn't get them when he was alive. There's a fairly, from my understanding, new rule in New York State where once you have a death certificate, you can fill out this form, to get the records. So, it took me a while to do that, because this is all very raw for me. And, as I've expressed, I harbor a lot of regrets and guilt that I didn't do more sooner, or recognize the signs and call and demand different things. And, so it was a lot of time for me where I had, before I could, from a really mental health perspective, be able to get these my dad's records and read through them, because I knew I was going to read things that were going to, further open this, gaping wound. And so I didn't get them until, I think it was August. And even still, I have not finished filling out my complaint to the New York State Attorney General or the Department of Health. I have a year to do it, because again, once I read everything, it's just like, I can't even bring myself to finish writing the things that I'm writing, because it's inexcusable, tragic, heartbreaking, senseless, criminal. There's the list goes on. Anyway, so I have these records, and I go through a ton of them, and I'll start with the one really quickly. I'll do this quickly because I do have to feed my child, apparently. On the 8th, I had mentioned that there was Marilyn, that nurse who was the psychiatric nurse that had helped get my dad off that medication when he was hallucinating. She saw him on the 8th. So I talked to him on the 6th. He stopped returning. He didn't return my message, are you okay, on the 7th or the 8th. On the 8th, she typed up in his general overview. Patients seen in follow-up today by referral in his chart and medications were reviewed. He does appear to be undergoing some stress and does appear to have some increased confusion. Apparently last night, which would have been on the 7th, He did not appear to remember, I'm sorry, apparently last night he was mildly agitated, but not a danger to himself or others. Upon my approach in his room, he did not appear to remember anything that has happened recently and did not appear to be particularly focused on any problem. So that's a change in status. He's confused, not alerted. Now keep in mind, on the 10th, I spoke to a nurse who said that he's fine. No one mentioned this, nobody. So this was just the rest of it's kind of like all canned. Care plan, patient to remain in rivastigmine, which is one of his meds. So actually, through reading this, I found out that they had him on a dementia med. So really interestingly, they decided to diagnose him in these notes with dementia as a result of that period of hallucinations, which resolved by discontinuing or really drastically decreasing the dose. So now in this psych thing, he's on paper, they continue to diagnose him with dementia. He did not have dementia. So very interesting. Yeah, but profoundly depressed, by the way, based on all their other mental notes, profoundly depressed. I mean, how could you not be? So that was the 8th. On the 9th is a note from the nurse practitioner. So keep in mind, I talked to the nurse on the 10th when he had his mild fall and told me he was fine. Okay. Chief complaint, resident is being seen today per nursing request. Nursing reports that resident does not appear to be himself. It was noted that the resident had reported a cough today during nursing assessed resident and found oxygen saturation on room air at 83%. Placed him on 4 liters of oxygen and then his O2 sat increased to 94%. It notes that his lungs sounded clear but diminished and that he currently didn't have a fever. Everything else, nursing reports non-productive cough noted today. Decrease O2 sat on room air. Let's see. It's funny, respirations are without effort. So like somehow respirations are without effort, but he's profoundly hypoxic. And here is her.
And for people who don't know, like 4 liters of oxygen is still pretty considerable for somebody who doesn't have like a chronic obstructive pulmonary disease or congestive heart failure. You know, for somebody who has healthy lungs, 4 liters is considerable.
And saturating 83% on room air is acute respiratory failure.
Yes. I mean, that alone should have sent him out to the emergency room.
Anything less than 94% should have. And so here's what's insane to me. The nurse practitioner's diagnosis, cough. Not once in this entire progress note is COVID-19 even mentioned. Not once in here is there any documentation of having a direct contact with a roommate with COVID-19, nothing. So we'll order chest x-ray and we'll continue with oxygen support as needed. Nursing to monitor and notify medical of any changes.
Now, again, I'm not a medical expert. You know, I don't work in healthcare, and this is a genuine question for you. How do they not put that in your dad's chart that he was exposed to COVID-19 and that they should be looking out for diminished O2 sats or
they should be looking for all these things.
A dry cough, which is from what I understand is the symptom for COVID, right? It's a non-productive cough.
Yeah, non-productive cough and hypoxia, which he had. And with a known positive COVID contact in.
Did they not test your dad?
They did not.
So they know that his roommate is COVID positive and they didn't test your father for COVID.
Correct. And, you know, that was one of the other things. They're like, oh, well, you know, we didn't have a lot of testing at the time. I said, I didn't ask you why you didn't test my dad for COVID. I asked you why you didn't send him to the ER. Because look, I knew he had COVID. We know what the test would have said. Like anybody would recognize these symptoms. He had COVID. He tested positive for COVID in the ER. He had COVID. So, I mean, that was like, oh, he was DNR, DNA. Oh, we didn't have enough diagnostic tests, so we didn't test him. I didn't ask you to intubate him. I didn't ask you to resuscitate him. I didn't ask you to test him for COVID. I asked you to call me and I asked you to send him to the ER. Those were the 2 things you are supposed to do and you failed on both accounts. So even with this, not only should they have notified me then of several status changes, a day later when I talked to a nurse, they said my dad was fine. They didn't tell me then he was on oxygen, which he was. They didn't tell me then he was confused. So now this is all making sense why he didn't call me, why he didn't reach out to me, because he couldn't. He was so confused. So I don't have the notes in front of me of electronic, but I went back and I had to read through thousands of pages to find the nursing notes. One of which was in the middle of the night, I believe on the 11th. So one was the fall documented. One was the middle of the night on the 11th with an LPN stating that she went in to check on my dad and he was so confused. He had no idea who she was. And he couldn't even he was like became a two-person assist to move because he was like so ill. He could like not even like help with his own movements, to move him. And it didn't say that they alerted anyone. She clearly didn't document that she called me. She didn't call me. I would have known. I would have remembered that. Next day at around, no, so, oh, by the way, from the time of the fall, no additional notes other than this one at 11, not an additional note, I think until maybe 11 something the next day on the 12th, of the nursing supervisor, an RN, assessing my dad. Oh, she keeps going there. He won't leave his oxygen on, like acknowledging that he's now on 15 liters non-rebreather because his saturations were in the 80%. Told patient he needs to keep his oxygen on. And her plan of action was, will continue to monitor. For what? Death? What are you monitoring at that point in time? You think he's going to magically get better? Or he's what are you, and no notification that she notified me or notified even the nurse practitioner. And no additional notes. There's no documentation other than in these notes, these progress notes where they mention his oxygen, or the progress note from the nurse practitioner that he was on oxygen. There's no, chart of oxygen and what his O2 sats were over time, or documenting that he was on oxygen other than these random notes saying it. So I talked to him on the 6th. On the 7th, he wasn't returning my calls. He was already confused on the 8th. So that tells you, at least from the 7th, he was sick enough to not be able to even reach out to me. And it was 5 days later in the evening, I found out that he was ill because I called and demanded he went to the ER. All those days sick like that, all these people checking on him, suffering. Like, it's not like, and I told this to the administrator, if all of a sudden, like, okay, so let's say they forgot to call because they went to check on him and, oh my gosh, they realized he was so sick, and in the haste to get him to the emergency room, someone forgot to call me. That would be fine. They did nothing other than put him on oxygen and sit there and wait essentially for him to die. And then what? They were going to call me and say, oh geez, we went to check on your dad and found him deceased in his room. We're not sure what happened, because he didn't have a COVID test. So they wouldn't have been able to say he had COVID. How was I supposed to know that his roommate, if the ER didn't tell me, and I didn't find out the details about any of this from Leonard's family until after the fact. And the way I, by the way, contacted Leonard's family is I found his last name eventually in his obituary and found the name of his daughters and found them through Facebook. And called and sent a Facebook message. But when you're not friends with someone, it doesn't like alert you that it's a Facebook message. So it even took a while later for her to see that. And then that's how we got phone numbers and more like, that's how I found.
So you had to be your own detective.
Yeah, I had to be, like 100 times over with all of this. So.
And just so people understand, Leonard died 8 days before your father.
No, Leonard, I think Leonard might have died after my dad. I don't, I'm sorry, I don't remember when Leonard.
Oh, okay. I know that, I think it was like an 8-day period of time.
Yeah, I think Leonard survived longer, which, yeah.
Oh,
which
did he? Wow.
I believe he did. Don't quote me on it, but I don't remember when Leonard passed, but yeah, they were so they were in the ICU in the same place at the same time with dying of the same infection. So yeah, so still to this day, the nurse practitioner never called me. I've called the administrator several times. I asked for Dr. Amadon to call. These people didn't even have the decency to return my phone call to find out what happened to my dad and why they didn't send him to the hospital. So then when I sent him to the hospital, there's a note from the nurse practitioner on the 12th, This provider was called at home on April 12th, approximately 7 p.m., and chest x-ray was reported to this provider by nursing staff with finding of bilateral infiltrates. She wrote in here, healthcare proxy was notified. But then she also, like, that's funny. I was notified or I called you and found this out.
Right. That's a really loose interpretation of, notification.
Although the nurse note did say that I called. Rocephin, 1 gram IM once a day for 5 days, and azithromycin, 500 milligrams once a day for 5 days, to be continued at 250 milligrams. I'm sorry, once a day times 1, then 250 milligrams for 4 days, was started at the time of this call. We also ordered Combivent inhalers. Is currently aerosolized treatments are unavailable to us, and they are not recommended with COVID-19. So those antibiotics, that's how you treat community-acquired pneumonia, community-acquired bacterial pneumonia. First of all, my dad lives in a long-term care facility. So by definition, he doesn't have community-acquired pneumonia. And that's important because the antibiotics would be different because the bacteria is potentially different. So here's a guy who is critically ill in respiratory failure. And the nurse practitioner is like, oh yeah, I'm going to order antibiotics to treat outpatient community-acquired pneumonia. How unbelievably incompetent. And I know this because this is what I do. This is just preposterous. But then she does document, currently residents most indicates DNR, DNI, however, can send to ER if medically necessary. So the nurse practitioner documents that this should happen. Residents, healthcare proxy is requesting resident be sent to the emergency room. Resident, or healthcare proxy is aware resident is DNR, DNI. However, she is continuing to request he be sent to the hospital. It's that tells you they had no intention to send him to the ER ever and just let him die or to see if he magically recovered. Why he sat alone in a room with no family knowing anything, not talking to anyone, not being able to say his goodbyes on his end, or nothing. They robbed us of all of that. I fail to understand what they could have, what's your rationale? What was your game plan here other than to potentially hide another COVID death? What were they thinking the outcome of this would be? And how many failures to notify family or failures to send him to an appropriate level of care? How many does it take? Seriously, and that's what I wanted to know. What was your line of thinking here? Because I can't come up with anything that makes any rational sense from a humanistic standpoint or a medical standpoint. It's just completely gross negligence. I don't know any other way you could justify what your plan was. And did you not call me back because you didn't have a leg to stand on? You didn't want to implicate yourself? By the way, the nurse practitioner ordered a chest x-ray on April 9th, and it wasn't done until April 12th.
And they have x-ray capability on site.
On site, yeah. When I asked about that, by the way, I had since called, once I got these records, I called the nursing home. They have a new administrator, and I had a conversation with her, actually very interesting. And then I actually really have to go. The day, so when I sent the request for medical records, I sent it through UPS and it required a signature. And shortly later in that afternoon, I got a call from Alice, who was now an assisting nursing administrator or something, claiming that the nursing administrator, Nathan, was just thinking about how, we haven't heard from Michael Grafasi's daughter in a long time, and we want to check on her and see how she's doing. So he had Alice call me on the day they signed for my request for medical records. Am I stupid? Come on. And so, yeah, they just wanted to call and see how I was doing. And I was like, how am I doing? I'm not well. What do you think I'm going to say? Everything's great, you guys. I'm not going to follow up, making sure that you're held accountable for your multiple failures across the board. And she said to me, I really cared for your dad, and excuse my abbreviation for language. She's like, I just don't want you to think that I'm an a-hole. I'm not an a-hole. I really cared about your dad. And it's what are you trying to accomplish here? Thanks for calling. I mean, I was nice, but at the same time, still no one answered any of my questions. Your nurse practitioner didn't call me back. Oh, well, she can't now. She doesn't work here anymore. So I found out that she was fired. Interesting. Very interesting that she was fired. So then subsequently there's a new nursing, our new administrator. I spoke to her. I wanted answers. She gave me a line of BS. And I did say to her, look, like, I know that, you're thrown into the middle of this and you weren't there at the time, so I can't hold you responsible for things that happened then, but you're in the hot seat now. And I'm just asking that you make sure these things don't happen anymore. Cause from my understanding, that's your job. But I said, I just want to know why no one called me and why no one sent him to the ER. Like, just explain yourselves. And she said she would look into it and call me back. And to her credit, she did. And she called back and she said, I can't say that they weren't going to call you. You just happened to call first. I'm like, really? You can't say that they weren't going to call me? When? How many? First of all, they lied when I did talk to someone on the 10th and said that my dad was fine, just grumpy. No one told me, as your letter said you were going to do if he was suspected of contracting COVID or being diagnosed with it. I don't get it. Like,
and again, they knew that his roommate Leonard was COVID positive.
Yes, and they knew that my dad's signs and symptoms were consistent with COVID. Like, what else could it have been? And honestly, if it could have been something else and not COVID, you still didn't send him to the appropriate level of care. He was in respiratory failure. And I'm going to read this one last thing.
And I just want to make it clear that, let's say this is not during the period of COVID. Your father is suddenly on oxygen. He's not responsive. He's not responding appropriately. Even if we do not have COVID in this case, the correct course of action would be a phone call to family and to send out to the emergency room for care.
They're supposed to notify with any status change. There were several status changes. It's funny. It's like they care about falls. So they called to notify my brother that there was a fall, but like none of this other stuff seemed important. You could have said two things in one call. Like, clearly this was intentional. And so I'm trying to find in the note here. Okay, this is from the nurse in the ER. Appears in distress. He is awake, appears ill, shows no apparent trauma. He is cyanotic, so he's blue, essentially from lack of oxygen, and dehydrated. He is oriented and cooperative. He appears anxious, frightened, uncomfortable, restless, and is bedridden. He is well developed, but appears unkempt. Decreased awareness, he's lethargic. Patient is oriented to time, he has general weakness. Mucous membranes, they're dry and pale to further demonstrate, how dehydrated he is. Respiratory, severe respiratory distress, patient can speak one word at a time. Prominent clavicular, intercostal, and substernal accessory muscle use. That's just essentially demonstrates how hard of a time he's having respirating. Prolonged respirations, cough, bilateral rhonchi, perfuse diffusely, coarse crackles, presently diffuse both lungs. I mean, all of this just says how unbelievably sick he was and how he was essentially left for dead. Like, I mean, he's blue and dehydrated and appears unkempt. No one was taking care of him. If you look at the nursing progress notes, there was like hardly anything. But like a few documentations over a period of days and days and days. There was nothing. They were going to leave him in there to die. And you know what? I've said this before. The Grand, again, they'll say, well, the Department of Health hasn't found us. Well, I haven't filed my complaint yet. I will. I promise I will. It will be scathing. I will follow up with the Attorney General's office. Look, at the end of the day, if all the Grand can say is, well, so-and-so didn't find anything, that just means your documentation sucks. And it's really hard to go in and find some of these things.
That you're good at hiding things.
You're good at hiding things. Like, yet there's not been a single person to articulate to me why they failed on so many levels. And unless they have some magical answer that like makes all of this make sense, and I'm just a person that knows nothing, and they've actually gone on the news after CNY Central aired a story and made a statement saying that essentially they refute what we're saying and that they did notify family in a timely manner. You didn't, and you know what? You have absolutely zero documentation to prove that you did, and you have documentation to show that I called. And there's documentation to show several days prior how sick he was, and not a single documentation that family was notified other than on the 10th with the fall. You have documentation that showed that you're going to continue to monitor and you didn't send him to the ER. You have documentation showing you were supposed to send him to the hospital when care warranted. So, you know, if no one wants to believe my expertise in the field and they want to hire an independent physician to review these, they're going to find the same thing that I did. This is not something that I'm not capable of surmising from medical records. I understand what I'm reading. I can interpret labs. I know what all these things mean. I understand what the chest x-ray read says. Like, they don't have a leg to stand on. So I guess the overall reason why I don't think they should acquire any more nursing homes is because, look, bad things happen, accidents happen, people make mistakes, but they clearly don't care about doing anything about them. And they only care about hiding things, not getting to the bottom of things. I mean, what's your other explanation? Like, there's nothing. I mean, the nurse practitioner doesn't work there anymore. Okay. They clearly didn't fire her because she was so great at her job. You know, like, there's been a lot of turnover there. Like, you can't be like, oh, there's some bad apples. Like, you know, it spoils the whole bunch. That's just how this works. And if you're not going to take these complaints seriously and just keep falling back on, well, the Department of Health didn't find anything. The Department of Health acknowledged to me that it's very difficult to investigate these things and to find fault, because they can only go by what they read and what people say. And let's be honest, are they going to incriminate themselves in medical records or incriminate themselves, you know, during these investigations? No, they're not. Like this.
So unfortunately, families like yours are left with the tragic death of your father, the emotional turmoil, and very little recourse.
And here's, like, as you know, I told you my background. I know what I'm talking about. They know that I know what I'm talking about. They know my background, and they still did this. Imagine the people that don't have family members that know anything about healthcare or don't understand what they're reading in a medical record and would have to pay for experts to try to surmise something. I don't need to. I know exactly what I'm reading. I just imagine all these other people and all these other patients that don't have the level of advocacy, because look what happened despite everything that I have done, micromanaged, intervened in, and this still happened. Like, there's hundreds and hundreds of people out there that they don't care about.
And they're falling between the cracks and they're suffering.
And they're okay with that. They're okay with these people falling between the cracks because they still get paid. And, you know, they care about the quality metrics of number of times somebody was sent to a hospital or admitted. And it's funny, you know, we talk, it's like, why would they not send someone to a hospital? That's one of the quality metrics for Medicare, is how many hospitalizations your residents have, because that is an indicator of poor quality of care at the nursing home. So you know how you do really good in that score? You don't send people to the hospital when they need it and they just die in their room, and you find out later and you say, oh geez, come on, they're an old person anyway, they died of natural causes.
Right. So the way of getting around it is just not sending people out to the hospital.
That's how you do it.
Because my mother's nursing home, which is county owned, the care center at Sunset Lake, it was recently pointed out by the chair of the legislation that the resident quality of care was at 2 stars. But I know for a fact that they send people out to the hospital. My mother had a fall in December, early December, and they had x-rayed her, but they still sent her out to the hospital because she's on 2 blood thinners, to make sure that she didn't have any kind of internal issues, internal bleeding, just to make sure that she was okay. She returned back to the facility that night. It was just a trip to the ER and back. But that counts against them.
It does. And if you look at, you know, the Grand and Rome in particular, all their other ratings, their star ratings by CMS are terrible, except for these quality ones, because those are the ones that you can game. I mean, if you scroll down, you could look at the number of residents that are like depressed and like on medication for depression. It's super high. It's sad. Like, this is, I mean, I've been in the nursing home, like, you know, and I hate to admit this, But even when the few times when I was in Rome, it's hard to spend a prolonged period of time visiting my dad in the Grand because it's just so sad there. I mean, it's tragic. Like everything smells like urine. People just like, you have some people in the hallway like that are clear, obviously have dementia and, just probably yell out all day long. But then it's like my dad would be like, would fall in the shower because he would have to bathe himself in order to be showered frequently enough. Like just no dignity. It's like, I mean, there's countless stories of people that would sit in their own filth and diapers for hours on end. I actually helped another family member because of trying to do something, from an advocacy perspective. Got in touch with someone, reached out to me with their family member was in an acute stay for rehab at the Grand in Rome and had some concerns, wanted to get their loved one out of there, didn't think they were being taken care of appropriately, and they weren't. Just by them reading me the med list, I realized I didn't, that this patient had C. difficile infection, so had C. diff diarrhea and was not being toileted and having diarrhea several times a day in a diaper to the point where their entire bottom was excoriated and had like this horrible like wound.
So a complete breakdown of the skin from lack of.
We're treating with like steroids, which you don't give someone steroids when they have C. diff, by the way. But then also was supposed to be getting therapy and wasn't getting enough therapy, was just really declining. And they said, I want to take my loved one out of here. Well, you can't do that. And so they were so upset and weren't convinced they were getting appropriate care. They called an ambulance from the parking lot. This patient went to the ER, actually was doing better than anticipated, which is great, right? That's what you wanted. You don't want to see them like too late and they're so sick. But the family member said, you can't send this person back to the Grand. Like she's being neglected. Look at her bottom. And like it was doing better, but you could still see that it was really bad. And it was like a Friday. By the time they did all the paperwork and everything, there was no place else they could send her. Social work was leaving for the day. So she went back. She was scared, depressed, only window visits. And so I'm talking to this person. I said, why don't you just request a lateral transfer to another nursing home? You can do that. I was like, absolutely, you can do that.
Right, because people don't know.
They don't know.
It is your choice.
5 times, and unfortunately, the place I wanted him to go didn't call back, or the Grand confirmed that they did send the request, but who knows? I honestly believe very little or trust very little of the things that they say because they have proved themselves not to be trustworthy time and time again. So,
but in New York State, we have the right to choose who treats us. We have the right to choose the doctor. We have the right to refuse medication if a doctor wants or treatment. We have the right to choose where our loved ones or as a resident where we are treated. So people don't understand this. And obviously they don't want to explain it because who wants to lose out on a patient, like
especially
a resident?
When Medicare, acute rehabs are some of the highest reimbursing stays in a nursing facility. They make a lot of money on those. So I worked with this gentleman to find a good alternative. I made the call myself to the nursing home to see if they had a bed. I told him, okay, I can't do this because it's a HIPAA thing, but here's all the things you need to do to make this happen. They're going to try to push back or blah, blah, blah. They did. It all worked out. This person got transferred to another facility, did so unbelievably, like they were disgusted, by the way, at the new facility, that the little progress that this resident made and the time they were at the Grand in Rome, and they did so incredibly well. They were discharged already at home, doing super well. And I'm not saying this like, oh, look at all the great things I did, but it was a very simple thing. I understand how this healthcare system works. And all it took was one person to put them in contact with me and me be able to tell this family how to navigate the system. Because they don't know. People don't know. And it's not like the Grand was telling them their options. And who knows what would have happened if this person stayed at the Grand. But like it's like I'm on their HIPAA forms now for their primary care provider. Like I help them. They don't have anyone else in the family, and I'm happy to do it. Because again, but a lot of people don't have people that know things. And honestly, what I failed to be able to do for my dad, I feel like I try to make amends for it and help anybody else that I can, and including this family who, although I've never yet met in person, I FaceTime, are, cherished friends to me. And, it's an elderly couple, but I mean, they're family to me now, and always will be. And, it's just so sad um, that people don't know how these things work, and people are take advantage of. And the family actually said to me, we felt as soon as she went into the Grand, like suddenly she had like no rights. And like me as a spouse, I suddenly had no rights. Like I felt like we couldn't decide or do anything, and none of this was up to us anymore. So,
which is not true.
It's not
true. It's 100% not true.
Not true. And I will say the facility that this resident went to, they were lovely. Like at first, like I'm like, hey, look, I'm calling, and I know you know me. And I was put on the HIPAA form. And once I was put on the HIPAA form, and they can discuss things with me, super eager to troubleshoot things, try different things. Like it all went, and they were lovely. At no point in time did they come off as like I was somehow bothering them, because they recognized that their goal was to help this person get better and get home, and recognize that me as a family friend just had the same goal. Like that should be your goal. You should want to help people, not try to make a buck and do the little bit possible, to keep someone kind of okay. And that's what the Grand does. They don't care about people. If they cared about people, they would stop this smear campaign about some of the, complaints filed, like, oh, this person said this and they filed all these complaints and they never find anything, or we did notify the family in a timely manner. You're full of crap. And you know what? The Department of Health, I'm sure, is under-resourced, they're limited in what they can look into, or essentially they have like criteria of things that they assess. They're not investigators. They're not filing criminal charges. They have a set of standards that they can enforce. And, even when they send you the report that says like if they didn't find anything, they say like, please note, this doesn't mean that what you said never happened. It's just that we couldn't prove essentially that it did. And like I said before, you're not going to write like, patient has a horrible rash because we refuse to toilet her frequently enough and make her defecate herself in a diaper and sit in her own filth for 6 hours at a time. Like you're not going to document that. So what's going to happen is you say that, and then you go in and you're like, does this person have to wear a diaper and sit in their own feces for 6 hours? No, we don't do that. It might have been a 45-minute delay because we were busy with it. I mean, come on. No one is going to implicate themselves in this situation. And that's exactly what's happening. And it's hard to prove.
And honestly, the Grand, they understaff. Their staffing rates through Medicare.gov are usually substandard. So they understaff. So they have fewer staff with higher demand. And so people are going to be neglected.
Yeah. That's it. They try to, and I remember what Dr. Amadon said to me the one time I talked to him during my initial complaint. And he's like, it's really hard, to get good people. These, the CNAs and the nurses, they're not paid enough. It's like, look, this is a for-profit nursing home. You decide how much you're going to pay your employees. Pay them what they're worth. Pay them more money. I mean, I'm sorry that it comes out of the lining your pockets at the end of the day. Like, you're not operating at a deficit. You're still turning a profit. Like, that's not an okay excuse. And what I said to Dr. Amadon is like, look, that's not an acceptable excuse. And you know what? You are a physician that has a contract with this nursing home to provide medical services. And if you think that residents aren't getting the appropriate level of care, and also that, the nursing staff there is underpaid, then don't have a contract to provide medical services at that nursing home. No one's forcing you to do it. Speak up, advocate for these patients, actually go in and look at them yourselves, or hire nurse practitioners, which is, what apparently I've only ever seen nurse practitioners, and that's the majority of these. Every once in a while, there's a different physician that leaves does like a maybe quarterly evaluation, but hire competent physician extenders. Like if you look at someone who is in respiratory failure and diagnose them with a cough and say, we'll continue to monitor. And then when it's very clearly they're like, hours from death, and you decide to treat them from community acquired pneumonia in the middle of a pandemic, you have no idea what you're doing. You are grossly incompetent. It's awful. So you'll hear countless of these anecdotes, and the grand, senior leadership will say, oh, you can look up what the Department of Health says. It doesn't tell the whole story. And I'm actually, part of my complaint to the Department of Health, and why it's taken me so long to write it, is like every line, it's like, we're like Exhibit A, this page, read this. By the way, what this is failure to notify in a status change. What this is failure to send to appropriate level of care. Like, I'm doing the investigation for you because I'm not confident that the state is capable of doing it themselves. And plus I have the records from the ER that, backs up a lot of this. But, and I'm not trying to talk crap about the New York State Department of Health. I'm sure they're under-resourced too. And there's probably a lot of complaints, and there's a lot going on, and it's very difficult. But if that's your only justification, or your only excuse that you didn't do anything wrong, and we're all making this up, like, literally, what do I stand to gain here? So people could be like, oh, well, people have asked, are you going to sue? Like, no, I don't want anybody's money. I'm a person I live comfortably. I don't need money from anybody. My dad had a ton of debt. So even if I could sue and he was awarded $200,000, it would just go to pay his debt. I wouldn't get a dollar of it anyway. I don't care about this. None of this is about money. This is about human beings. These are people that we entrust these professionals to entrust for their care. They live there. This is their home.
And we shouldn't have to, families like yours shouldn't have to resort just to a civil suit to find justice for your father. No. There should be a system of checks and balances. There should be regulation. There should be a way for you to find justice for your father and protect other people without a lawsuit. Yeah, because as you just said, it's not about money. It's about
settle out of court anyway, and then there would be no admission of guilt or culpability in any of this. So, if the best I can do is hold them accountable from, like if the state wants to do something, or the Department of Health wants to do something, that would be great. But other things I can do are, if someone reaches out for help to try to get their loved one out of a terrible situation in that facility, and I can help do that because it's the right thing. Absolutely. I'm not here like trying to sneak, like trying to transfer residents left and right. Like, I only know if someone asks for my help and I can help them navigate the system. But if I can help by sharing the story and sharing what I know from my own personal experience and my medical expertise to try to prevent this nursing home this corporation from further lining their pockets at the expense of human beings, that's a win for me. I mean, I don't know who the other players are in town to potentially acquire this nursing facility, but I'm sure the Grand talks a beautiful game. I'm sure they say a lot of really lovely things. And I think that you'd be hard pressed to find residents that would share in their enthusiasm of what a great job they do. Now, I know that on social media, there was a younger resident that lives at the Grand in Rome who sings their high praises, but of course, someone who is fully capable and young and can, knows how to get on social media and do all these things, of course, this cheerleader is going to have a wonderful experience. Why would you not cater to that person? But the people that can't speak for themselves, or can't have family come in and see what's actually going on, like, they're not going to get the same level of care. So, like, I'm sorry, it's completely biased. And I have medical documentation of everything. Like, this is not my emotional subjective, response to what happened. Like, there is documentation and labs and everything to back it up. Like, my dad went to the ER, was emergently intubated, and went straight to an ICU. Like, this is not me being over exaggerating of what his clinical status was and having no idea what I'm talking about.
Right. So, Marissa, thank you so much for your time. I think that everything that we discussed today frankly has me more panicked at the idea of the Grand possibly taking possession of my mother's nursing home. And again, not for my mom, because I'm a very strong advocate and I have 3 siblings who, if I fall down on the job, will pick up the cause. But I am really panicked for the people in my community because we did not discuss this, but I live in a rural community that has a high rate of poverty. Of the 62 counties in New York State, we are 60th in health outcomes, right? So we're a very unhealthy county. So the people who are here, by the time they end up in our county nursing home, they have gone a lifetime with either very little healthcare or poor healthcare. And so, frankly, my urgency is in advocating for my community and those people who won't have advocates, who don't have a strong voice or can't like reach out to people like you for more information.
Mhm.
I'm afraid of the suffering that will happen for those folks.
And I don't mean to sound alarmist at all, but I think that your concern is well founded. And I mean, I don't know who the other options are, and maybe they're not so great either. But I don't care what picture the administration at the Grand paints. They are not great. They are not grand, and they do not. I forget when you call the phone number, like, we give residents the care and dignity they deserve. No, they don't. And unless they can express to me otherwise and articulate what their plan was with my dad, as far as I'm concerned, and all the evidence suggests that they intended to leave him in his room with COVID and not tell his family and then call us when he died. Suffering. I mean, just it's inhumane. It's cruel. Um,
Yeah, the other 2 options, one I'm not terribly familiar with. The other one actually has a nursing home in our county. And they've owned it for 2 years. And honestly, in my research there, my preferred choice, Vester Care and the McGuire Group, they own the Roscoe nursing home in Roscoe, New York. So, but I've been researching the Grand and following this since they announced in July they wanted to sell my mother's nursing home. And the Sullivan Times did dig up some information about the Grand, including the fact that the Department of Labor found that they were underpaying their employees and they had to pay over $2 million in back wages and then financial. Yeah, there was financial penalty. I'm happy to forward that information
I,
on to you.
that doesn't surprise me, but my shock more so is that they were held accountable for that.
Well, it was an investigation for 5 facilities, 844 employees, and it was over a period of 3 years. So I'm sure there was a lot of very upset employees
Yeah.
who repeatedly reached out. And I don't know, do they have a union? Are they unionized?
I don't think so, but I'm not sure.
Yeah,
I
I'm not
can
sure
definitely
either
look
because
it
we
up.
have 2 unions, of course, with our nursing home. One is NYSNA, the New York State Nursing Association, and the other one is the Teamsters 445. Um, so I don't know what happened with the Department of Labor investigation that led to that, but I will forward that on to you. I believe
I love
that
appreciate.
result was in 2017.
Wow.
So yeah. Um, so yeah, thank you for your time and your advocacy, and I hope to talk to you again soon in the work that we are both now doing. So thank you so much,
You're
Marissa.
welcome. And thank you for your time. I know this is a lot longer than probably both of us anticipated, because there's a lot to tell. But thank you for listening and for your advocacy. And if there's anything I can do, don't hesitate to reach out.
All right, thank you.
Take care. Bye bye.